Hello, I'm Dr. Ducey, and I'm going to open up your JFAK so you don't have to. So one of the key purposes is in order to try to keep it consistent between rotations. Ideally, you'll keep yours sealed up, obviously open it up if you need to, but it's important to be familiar with everything that's going on in here so that if you need to use it, you know what you have to work with. First off, over here on the side, we have the tourniquet. In order to get more information about how to use the tourniquet, I'll include a link below, but you'll want to refer to your TCCC training for a lot of that. Just remember to keep it high and tight. Opening it up, we see the basics in here, and I'll go through each one individually. First, we have a dry, sterile burn dressing. One of the biggest things that this is going to do is, in case of a wound, it helps prevent infections, keeps things moist, helps with the healing, and decreases pain associated with a lot of the burn wounds. There are a few H bandages and flat folded dressings. So what these are going to do is they're going to act as compression wraps. There are instructions on the back, but it also is discussed in your TCCC as well. So basically you can think of these as compression bandages. Many of them will have a little Sharpie in them. What the Sharpie is for is documentation, not just on the tourniquet, which has a time, but if there's any vitals that you get on the patient or patient information, in case once they come to medical, they're not able to communicate, that'll be useful. Some eye protection, so in case of an eye wound, you could put this over the eye in order to keep it from becoming more traumatic. So put that over the eye, wrap it to keep it the way it is. There is compressed gauze. This is also going to help with the dressing of wounds, as opposed to combat gauze, which is quick clot. So this will help with any external bleeding that you happen to see. So it'll help clot the wounds. These little sealed up black things are gloves, so make sure before you end up touching any blood or fluid or anything like that, touching the patient early, grab a pair of gloves, put those on. You have a little roll of duct tape. We'll talk more about the use in a little bit. Usually that ends up helping seal chest compression, or the chest wounds, for sucking chest wounds. Here we have a nasopharyngeal airway. There should be some lubricant in here as well, so make sure you use that. Yep, and a little bit of lubricating jelly. So if there's a compromised airway, you'll want to use this in order to go through the nose in order to maintain that sort of airway. Here we have a handheld cutter. So basically you can put this, and this will help cut any belts, clothing, etc. that you need to get off of the patient quickly. And here's the hyphen vent for those sucking chest wounds that I talked about that you'll need to bring down with that duct tape. So as you can see, there's a lot going on with JFAK. Now you know what's in yours in case you ever need it.